So, and we often, it's hard to measure that, in our usual, clinical setting.
Thank you. So, what advice do you have for cardiologists and other healthcare professionals who are interested in incorporating nutritional counseling into their practice?
I think first and foremost, we have to have a change in mindset. And what I mean by that is that we have to step back and look at the body as a whole. So my training in medical school, and we learn about the whole body, and then you go to, you do your 4 years of medical school. Then I trained in internal medicine, where we, looked at adult, chronic illnesses as a whole. So we look at the cardiovascular, the endocrine, et cetera, et cetera. And then I went and specialized. So internal medicine is a specialty of itself, and then I subspecialized in cardiology, and then focused on the cardiovascular system. Then I subspecialized in cardiac electrophysiology, where I just think of the electrical abnormalities in the heart. And our medical training is, or medical indoctrination, if you will, puts us compartmentalize our thinking. To where someone says, "Oh, atrial fibrillations, arrhythmia in the atrium," but atrial fibrillation is a systemic disorder. And so, what I would like to share with my colleagues is to step back and think of the body as a whole, readjust our thought processes in terms of how we deal with heart disease or disease in general, cardiovascular disease in particular. And somebody who's presenting to you with, coronary disease, who've had a heart attack, step back and say, "Okay, well, why did they have a heart attack?" And they may have other types of diseases that may be a trigger to that acute event. And so we need to think of our patients as a whole, think of them as a biological system in total, and treat that biological system as a whole. And so if you start that mental construct, then nutrition becomes a logical first step, or I should say optimal nutrition becomes a logical first step toward helping the patient get better.
Thank you. So, can you elaborate on the differences between LDL and HDL cholesterol and the optimal levels patients should aim for according to your research and experience in your practice?
LDL cholesterol is the one that we think is more the atherogenic component. It's prevalent in the large VLDL molecules, but the atherogenic molecules like ApoB. So it's the cholesterol that's associated with plaque development. And also the small LDL particles are also atherogenic. HDL removes LDL from the bloodstream, so it's thought to be the police. Again, ideal levels of LDL, you certainly want your LDL cholesterol. I tell my patients, with heart disease, if it's less than 100, it's good. Again, back to my earlier statements, that in of itself is not the end all be all, it's how you get there. So, if their lifestyle is optimal and they're doing everything great, the LDL cholesterol is 110, 109, I'm not going to make a fuss over it. I'm certainly not going to put them on a statin. Sometimes we use supplements, sometimes we optimize their diet. But LDL cholesterol, the data is shown in people with heart disease, you want to get that lower. Somewhere in the neighborhood, less than 100 is ideal. Some people showing even 70. Again, it may be beneficial for heart disease, but getting LDL cholesterol, unnaturally getting it there, may not be the best way to do it. Naturally getting it there is going to be good, because that means the body's in homeostasis to where you don't need that much LDL cholesterol. So then the LDL cholesterol is going to naturally be low. HDL cholesterol, we used to think, high HDL cholesterol is good. They've made medication to increase HDL cholesterol. These drugs have become more problematic. There's not been a lot of data showing benefits of HDL cholesterol. In fact, we see someone get on a healthy diet, when the LDL cholesterol come down, the HDL cholesterol will come down also. I like to think of the HDL cholesterol as police. How many police do you need? I don't know. Depends on how dangerous the neighborhood is. If you have a neighborhood watch system, you have good school systems, and the kids are raised right, the jobs there, and there's no, crime, etc., you don't need any police, or maybe one or two, if traffic stops or whatever. But if there's a lot of crime, a lot of craziness going on in the community, then you need a lot of police. So the amount of HDL will depend on, in my opinion, what's needed And oftentimes people with high HDL levels because they have lots of atherogenic molecules around that needs to be removed.
So, what are the biggest challenges you face in convincing the medical community about the efficacy of dietary interventions for chronic disease?
Well, I mean, it's just upfront the importance of it. Now, I have individuals who admit to the hospital and they have like acute coronary events, and we'll put them on a nutrition plan, et cetera. And again, I hear, like my colleagues, one, there's no level of intellectual curiosity about it. They joke about it. So I think it's just they're just not aware of it. I mean, it's you know, uh, how do I teach a cockroach to ballet dance? I'm not sure. I mean, it's just,
Okay. I love your no, I didn't mean to interrupt you. I love your analogies.
incapacity, of the brain. So it's hard.
Okay, so what is your stance on the use of supplements in conjunction with a plant-based diet? Are there supplements? Obviously, B12 is a popular one that I think basically all the doctors I've encountered say you should be on. Are there other things that everyone should be on? Are there things that are hyped up with regard to supplements that maybe people should avoid?
Yeah, there's a great question about supplements, and supplements is one of those things that we need to, give a lot of thought to. Our approach is simply this: we try to measure uh, um, levels of micronutrients. There's a special blood test that looks at intracellular micronutrients. We send it off frequently, use that. And we try to use that as a guide. And I mean, there's no one test that's perfect in my opinion because the biological system is just so complex. But we try to use blood tests as a guide to say, okay, where are the key deficiencies? And then we will target supplement in those areas. In addition to that, we'll then have them consume plant foods that are rich in those micronutrients that they have a deficiency in. So we'll use targeted micronutrients. Also, we'll have food sources, so we'll skew the diet. We also recommend people consume algae. I mentioned the ethylene algae, sea moss, grasses. These things are high in minerals and proteins and micronutrients. And so they will help supply the body with lots of micronutrients because there are many micronutrients we don't measure routinely or can't measure. And so you want to supply the body with superfoods that have a large amount of these minerals and micronutrients. Supplements you have to be careful with. One, how do you procure your supplements? We say, oh, take a B12. Well, I mean, patients may go and get a B12 over the counter. I don't just say take it. If they need a B12, we have a B12 that we get from a source that's specially formulated, it's tested, et cetera. And so we supply them with the micronutrients that we think that they need. And so, this is, I think, very important, largely because supplements can have an adverse effect also. I mean, nothing's a free meal ticket. And supplements, by definition, are not natural. So yes, we do supplement on a regular basis. We try to do it in a targeted fashion. But as an adjunct, or should say the main treatment, we try to help our patients find natural nutritional sources for these micronutrients as well.
Okay, so about 14 minutes left. I'm going to throw it out to the audience for a couple of questions. So David R., please state where you're from and ask your question.
Hi, I'm from Massachusetts. Good morning, doctor.
Good morning.
I would like to follow up on the discussion about the cholesterol level and statin. I'm on a plant-based diet for about 10 years, living quite a healthy lifestyle. I have no heart symptom, but because of high calcium score, I did coronary CT angiogram analyzed by Clearly AI, and they found that I have about 40% blockage in one of my arteries. I did advanced lipid panel, and they found that my total cholesterol is 135, LDL 73, but they found very high LDL particle level of 1400. And I have also low inflammation. The CRP was 0.5. if you would have such a patient with such a detail, would you recommend him to take statin or red yeast rice to lower the LDLP? And how often would you recommend to do again the coronary CT angiogram as a follow-up? Thank you.
It's a great question. So you mentioned being on a plant-based diet for 10 years. My approach to this, so let's say a patient walked in exactly with the scenario you presented. First and foremost, I look at the diet. Plant-based diet doesn't tell me anything. So I say, okay, exactly what you're eating over the 10-year period of time, because that can make a huge difference. And so a large percentage of the time, we can make some changes in that nutritional regimen. So I had a patient come in, similar situation. He was on a plant-based diet, low fat, et cetera, et cetera, et cetera. He was cooking just about everything, microwaving most of it. He had poor dentition because he had to microwave it. He was having angina, very bad, poorly calcified valve. He's a very severe case of coronary disease, very difficult to treat. But we started him off with a smoothie feast because he had poor dentition. I would put him on raw, but he couldn't chew the solid raw, so put him on smoothie feast, ECB therapy, and his angina went away. Reduction requirement of nitroglycerin went down significantly. He improved significantly. So by significantly changing the diet, and that's why we call it a defined plant-based diet. And when we published it initially, we attached that phraseology to our food classification system. So first, I'll start with being more precise with how the nutritional regimen is applied. Mentioning calcified coronary artery, that's what chelation comes. You're not going to stent the 40% lesion. So in the allopathic world, you're going to wait till it becomes 70%, then you'll stent or bypass it. But we may treat that individual with an aggressive raw detox diet. We may use Plaque-X infusion and chelation infusion in combination. Plaque-X can help reduce lipids, cholesterol levels as well. Chelation will help open those arteries up and improve coronary flow. And then over time, we'll follow those lipid particles. And typically what we see is those lipid particles improve with things like time-restricted eating, a precise plant-based diet, intermittent raw detoxes mixed with some cooked, et cetera. But when you cook your food, we have to, cook it in a precise way. Obviously, I'm going to fry it, but we don't recommend microwaving. And so we try to be very precise in terms of how the food's procured and how the food's prepared. And I learned even yesterday with Dr. Ryan, man, we promote organic. He's saying, well, yeah, a lot of organic greens don't have as much nitric oxide. So we have to rethink that whole process. So, probably have to go and start measuring the nitrites in the foods that we order for our patient.
All right. Next question is going out to Cheryl L. Please state where you're from and ask your question.
Yeah, hi, Doc. I'm from Maryland.
Good morning.
It's kind of good morning. It's kind of a multifaceted along the same line of diet, but in the plant-based community in general, there seem to be differing opinions about some of the basic ingredients like SOS, and oil, no oil, olive oil, no olive oil, salt, no salt, etc. And so that's part of the question. I'm wondering, have you seen clinically that any one of those particular elements is more important for the control of blood pressure specifically? And also, like, for instance, I know I dropped my blood pressure significantly when I took oil out. I stopped using it at all and cooking, etc. And of course, some sneaks in here and there with different things you may eat, but for the most part. And so that's one of the questions. But that to me relates to the overall theme that I think is that all disease is related to inflammation. And so if that's true, and specifically also with regard to blood pressure, do you see, just if somebody is plant-based diet for the most part, and no, I don't mean processed plant-based diet, I mean following a healthy lifestyle, is there an element that you see within the food kingdom there that's more contributory to high blood pressure? Thank you.
Great question. And I understand the nature, the complexity of it, because it does get complex. In the plant-based kingdom, we all agree on plants. We have to find something to argue about, salt, no salt. But to address the first component of the question, the oil and salt and the like, we don't propose oil. Now, when you think about, know this, know that, sometimes you have to step back and say, okay, what's the context of it? So for instance, we like cold pressed juices and smoothies, and you hear Dr. Esselstyn, you don't like smoothies and cold pressed juices. And it's not like, okay, well, one's right, one's wrong. You have to think about the context of it. When we look at cold pressed juices, we're looking at cold pressed juices. It's raw, extracted, etc. You're getting the best produce, etc. When people think about juices, oftentimes it's pasteurized off the store, and that's a problem. Also, we're looking at it in the context of someone who's very sick who can't chew or whatever the case is. So oftentimes you have to look at these things in context. So back to your question, oil. We tend to say stay away from oil. Seed oils are the worst because they're, chemicalized, extracted, heated, et cetera, Oil from a pulp, avocado is supposed to be, more tolerant of heat. But the problem is that when you're getting these things off the shelf, they're highly commercialized foods. I was looking at a document just last night, in fact, talking about olive oil. It's all in a cold pressed olive oil. Most of the cold pressed olive oil is not cold pressed, and it's some of it's some olives, some of it's some other stuff. And so you don't know what you're getting with the oils, and these foods can be rancid. And they can be very problematic. You can make a similar argument for wheat, because the wheat's a very commercialized substance. A lot of wheat has, abnormal gluten molecule. It's not the original wheat people ate thousands of years ago, et cetera. So you have to look at the context in which these things are. So oil, I think it's safe to remove from the diet. Salt, by and large, yes, you want to remove it, because most forms of salt comes in the form of preservatives. It's in the form of a overly processed salt, so that's going to be bad for you. However, we have patients that we see who have, probably due to poor adrenal gland function, a lot of heart failure patients, low sodium, they have low blood pressure. We have to, add salt to their diet. Now, we don't add regular table salt. We'll add like a Himalayan sea salt or a Celtic salt that's like the whole mineral and not an extraction of the mineral. So in some contexts, we have to add salt to the diet, certain people, certain, illness in certain situations. And in my practice, we see a significant number of these people. It's not like every other patient, but a significant number of patients. And so you have to look at the context of this, situation. How food's prepared is important in terms of the nutritional regimen. And is there another part of that question I'm leaving out? I don't want to, there was a great question that I don't want to leave it out. If you want to come back on and just
Yeah, sure. Cheryl, go ahead. Was there anything else?
Well, it really relates to the overall theme of inflammation, and inflammation being at the root cause of disease.
Yes, good question. So inflammation, I think it has it's a counterpart to oxidative stress and abnormal microbiome. So yes, inflammation is one of those root pillars, and inflammation is brought on by lots of different things. Exercise can cause inflammation. Exercise is a good thing. And the other point I wanted to make along the lines of inflammation and along the lines of diet is also we need to be mindful of micronutrients. And in our last conference, a colleague of mine who is an expert in micronutrient analyses, you want to test for these micronutrients, because again, our food sources have been compromised, and the minerals and things that we get are not quite adequate. And it's hard to really know. I mean, for instance, if your blood pressure is very high, what if you have a zinc deficiency or intracellular magnesium deficiency? And you're not getting the blood test may show the magnesium to be normal, but the blood pressure will be high because these micronutrient tests are abnormal. Or there may be some antioxidants that are more protective for your system than others. So we start to look at these things in addition to that. So inflammation is key. Getting that down is important, but also get some understanding of the micronutrient balance. If there are micronutrient imbalances, You may need a probiotic to help with absorption. You may need targeted micronutrient or mineral supplementation to target those minerals to improve things. And we've had patients who are on plant-based diet, they're doing well, blood pressure very high, and we see the magnesium low. We supplement magnesium, blood pressure comes down, the sleep improves. So micronutrients is another component. So our system of food has gotten to be so complex. Our approach needs to be more precise and more detailed. It's not enough to say whole foods, plant-based, SOS. Yes, that's a reasonable start, but you have to pierce into things. You may have to add more raw, more time-restricted eating, more micronutrient analyses and targeting, and some of these adjunctive therapies to help reverse some things that have been accelerate reverse of some of these things like mitochondrial function, endothelial, nitric oxide production may be severely impaired. And it may not be enough to be on an SOS diet to enhance that. You might need to supplement nitric oxide to a certain extent while you're eating your leafy greens. And of course, you need to make sure leafy greens have adequate nitrates in them. And so there are a lot of different things that we have to look at from a biochemical standpoint as we try to nourish the body.
So we just have about 30 seconds. So I'm going to ask you a question. You may not know about the subject. You may, because it was the first time I had actually heard about it. We had a PhD by the name of Dr. Michael Nels on as a presenter, and he brought up lithium as something that he recommended people taking, that it was originally in the environment. It is no longer in our, found in the environment, kind of like B12. Just within like 30 seconds, if you can, what are your thoughts on lithium supplementation, and are you aware of it?
I don't have personal knowledge, but he may be right. I mean, I'm learning things every day, so I'd like for you to send me a link to that talk. Or maybe send me a link to that, maybe one of his papers. I would love.
He has actually quite an extensive paper on Substack. If you look up Dr. Michael Nels, Nehls, and we can have John send you the link. I actually have the link if you'd like.
Yeah, email me the link, please.
We will absolutely do that.
So I learned something. That's good.
All right, perfect. Maybe next time you speak, you'll be doing a whole presentation on the power of lithium.
I'll be talking about all the lithium measurements we made and all the changes.
That's great. So with that concludes our time. So thank you so much for that extremely informative presentation. I really enjoy the information that you share. If we can unmute the audience, please.
Thanks, Doctor. Appreciate it.
Thank you. Appreciate it. Amazing.
Oh, that's so much. I thought it was this.